Hello everyone. Have you ever wondered why the same energy device can either make a clean incision, seal a blood vessel perfectly, or accidentally cause thermal injury? The answer lies in understanding the tissue effects of surgical energy. In this video, we'll simplify the principles of laparoscopic energy sources and explain how tissue responds to heat from cutting, coagulation to vessel sealing and coaptation. Let's begin. Every energy device interacts with tissue by generating heat. As tissue temperature rises, predictable biological changes occur. At normal body temperature, there is no tissue injury. As the temperatures reach around 45 to 60 degrees Celsius, cells begin to experience reversible damage. Once the temperature crosses approximately 60 degrees Celsius, proteins begin to denature. This is where coagulation starts. Between 60 to 100 degrees Celsius, collagen contracts, proteins denature, and blood vessels seal. This is the temperature range used for achieving hemostasis. When tissue reaches 100 degrees Celsius, intracellular water boils and rapidly vaporizes. Cells burst apart, creating a precise tissue incision. This is the principle behind cutting. As temperatures continue to rise above 200 degrees Celsius, tissue becomes charred or carbonized. Carbonization is an undesirable mechanism because it increases thermal injury, produces excessive smoke, delays healing, and reduces the efficiency of energy transfer. Now let's look at the different tissue effects individually. The first is cutting. Pure cutting current produces a continuous waveform that rapidly heats the tissue above 100 degrees Celsius. Water inside the cells vaporizes instantly, causing cellular explosion and tissue division. Because there is very little coagulation, cutting creates a sharp incision but provides limited hemostasis. This is why pure cut mode is commonly used during peritoneal incision or colpotomy. Next comes coagulation. Coagulation occurs at temperatures between 60 and 100 degrees Celsius. Instead of exploding, cells undergo protein denaturation. Blood vessels shrink, collagen contracts, and bleeding stops. Compared with pure cutting current, coagulation causes greater lateral thermal spread because heat remains within the tissue for a longer time. Now let's discuss desiccation. Desiccation occurs when the electrode is in contact with the tissue. As energy is applied, water gradually evaporates from the tissue. The tissue dries, shrinks, and its electrical resistance increases. Eventually, the current stops flowing automatically because the dry tissue no longer conducts electricity effectively. Desiccation is commonly seen with bipolar forceps during spot coagulation and ovarian cystectomy. Another important tissue effect is fulgration. Unlike desiccation, fulgration occurs without direct contact. The electrical current jumps through an air gap, producing superficial coagulation and superficial carbonization. Because penetration is shallow, fulgration is useful for treating superficial bleeding points or small endometriotic implants. Now let's talk about carbonization. When tissue temperatures exceed approximately 200 degrees Celsius, proteins are destroyed and tissue turns black. Carbonized tissue has high electrical resistance, making energy transfer inefficient. It also generates more smoke, obscures vision, delays healing, and increases collateral thermal damage. Whenever possible, surgeons should avoid prolonged activation that leads to charring. Now let's move to one of the most important concepts in modern laparoscopic surgery, that is advanced bipolar vessel sealing. Unlike conventional bipolar coagulation, advanced vessel sealing devices do much more than simply coagulate tissue. They rely on a principle called coaptation. So what exactly is coaptation? Coaptation is the controlled compression of tissue between jaws of a vessel sealing device before and during energy delivery. This compression pushes the blood and tissue fluid out of the vessel and brings the collagen and elastin rich vessel walls into intimate contact. Once the adequate compression has been achieved, the tissue delivers precisely controlled bipolar energy. At temperatures of around 80 to 100 degrees Celsius, collagen and elastin denature. As the tissue clots, these proteins reform crosslinks, permanently fusing the vessel walls together. So, this is simply not a blood clot, it is true biological fusion of a vessel. Whereas coagulation is pure thermal effect due to protein denaturation. It stops bleeding by clot formation and vessel plugging. That's why vessel seals created by advanced bipolar devices are much stronger and more reliable than conventional coagulation. Modern instruments such as Ligashore, Enseal, Cayman, and the bipolar component of Thunderbeat all work on this principle of coaptation combined with controlled energy delivery. Many of these devices also monitor tissue impedance in real time and automatically stop energy delivery once an optimal seal has been achieved. This minimizes unnecessary thermal injury while creating a durable seal capable of safely closing vessels up to 7 mm in diameter. Now let's compare this with ultrasonic energy. Unlike electrosurgery, ultrasonic devices do not pass electrical current through the patient. Instead, the blade vibrates at approximately 55,500 cycles per second. These microscopic vibrations generate mechanical friction, causing protein denaturation at relatively lower temperatures, typically between 50 and 100 degrees Celsius. The result is simultaneous cutting and coagulation with less smoke, minimal tissue sticking, and reduced thermal spread, that is, lateral spread. This makes ultrasonic energy particularly useful for delicate dissections around vital structures such as bowel and ureter. Finally, let's summarize the lateral thermal spread of commonly used energy sources. Monopolar electrosurgery produces the greatest lateral thermal spread. Conventional bipolar is more controlled. Advanced bipolar vessel sealers and ultrasonic devices generally limit the thermal spread to approximately 1 to 2 millimeters, making them safer for surgery near critical structures. So, the key message is simple: always choose the right energy source for the right surgical task. Use cutting current when you need precise tissue division and coagulation for hemostasis, and you avoid prolonged activation that causes carbonization. Now that we have understood the tissue effects of different energy sources, let's understand the physics behind the commercially available energy devices. Laparoscopic instruments rely on five basic types of energy: electrical, mechanical, plasma, ferromagnetic heat, and laser. Let's start with electrical. Monopolar is one of the oldest and still most widely used form. Current flows from the generator through an active electrode through the patient's body and back through the grounding pad. Because current travels through the whole body, monopolar can cut and coagulate very effectively, but it also carries risk. Stray current can injure tissue far from the surgical site, especially near metal instruments or if the grounding pad isn't placed correctly. That risk comes from stray energy paths through direct coupling, capacitive coupling, or accidental contact with tissue outside the surgical field. Monopolar devices can safely divide vessels up to 2 millimeters. Both monopolar and bipolar devices use high frequency alternating current. Bipolar energy solves the stray current problem which is seen with monopolar. Instead of the current traveling through the whole body, it flows only between two jaws of the instrument through the tissue grasped in between. No grounding pad is needed. This makes bipolar safer for delicate structures. But bipolar is traditionally slower and less capable on larger vessels, which is exactly why advanced bipolar systems were developed. The devices like Ligashore, Gyrus PK, and Enseal PTC combine bipolar energy with mechanical jaw pressure and critically a feedback system that measures tissue impedance in real time and automatically adjusts power. The Ligashore, for instance, remeasures tissue resistance over 3000 times per second and automatically adjusts the energy delivered. The result is vessels up to 7 millimeters can be sealed, with lateral thermal spread often under 2 millimeters. The Enseal PTC takes this further with what its manufacturer calls smart electrode technology, a temperature control system that caps the tip temperature and reduces the overheating even more precisely. The next type of devices are plasma devices. Plasma is the fourth state of matter, and in surgery, it means that ionized gas carrying a very small electrical current. Devices like the argon beam coagulator and the plasma jet use this stream to cut, coagulate, and fulgurate, all without direct contact. Plasma devices generally show the highest thermal spread of any category. The argon beam coagulator alone can spread heat 4 to 10 millimeter laterally, but newer devices like plasma jet and J plasma have narrowed the gap considerably, in some cases keeping the thermal spread under 2 millimeters. The next category of devices are ultrasonic devices. The harmonic scalpel family of devices work on pure mechanics. A piezoelectric element vibrates a blade between roughly 23,000 to 55,000 times per second. That vibration does two things. It rapidly heats the blade surface through friction, and it triggers cavitation, the formation and violent collapse of microscopic bubbles that tear tissue apart at a cellular level. The advantages is that it produces minimal smoke, excellent precision near delicate structures, and produces simultaneous cutting and coagulation. These devices reliably seal vessels in the 2 to 5 millimeter range. But the downside is that ultrasonic blades run hot, so tissue just a centimeter away can reach 60 to 140 degrees Celsius heat, and they can stay hot even after you release the trigger, sometimes still over 50 degrees Celsius several seconds later. That's why the standard safety advises short bursts, ideally under 5 seconds, with pauses in between, and always keep the active blade in view. The next section of devices are the hybrid devices. There is the Thunderbeat from Olympus, a hybrid device that fires both ultrasonic and bipolar energy through the same jaw simultaneously. The idea is to combine fast cutting nature of the ultrasound with reliable sealing nature of the bipolar current. The newest one is the ferromagnetic device. It is the newest category on this list, and it is represented by a device called FM wand. Instead of pushing current through the patient, this device runs radiofrequency current through a ferromagnetically coated loop, generating pure heat through magnetic and ohmic effects that's conducted directly into the grasped tissue. No grounding pad is needed and no stray current risk. Early studies with this device are promising. They are showing vessels up to 7 mm can be sealed. Burst pressures are comparable to advanced bipolar devices and less lateral thermal spread than the harmonic scalpel, and notably faster transaction times. So now a question naturally arises: which device is the best? There is no single best device. Across comparative studies, Thunderbeat consistently posts the shortest cutting times, highest versatility scores, strong burst pressures, and low smoke production. It's also been linked to shorter operative times and less postoperative pain in gynecological patients. Ligashore tends to seal fastest with the highest burst pressure. Harmonic scalpel also tends to produce the least smoke. So, the take home message is that if you're prioritizing minimal thermal spread and smoke, ultrasound devices tend to lead. If you want the fastest, most reliable seal on a large vessel, Ligashore and Thunderbeat perform strongly. If you're working near nerves or delicate structures, ferromagnetic heat devices and low thermal spread ultrasonic tips look especially promising. Traditional monopolar energy, despite being the oldest tool in the box, still holds its place for its speed and simplicity. Monopolar is for general cutting and coagulation, bipolar for precision near sensitive structures, ultrasonic for simultaneous cutting and sealing with minimal thermal spread, advanced bipolar or hybrid devices for sealing larger vessels safely. Thank you.